Psychedelics Today, a weekly podcast exploring the science and culture of this new emerging psychedelic field with your hosts Kyle Buller and Joe Moore. So today on the show, we're joined by Dr. Alexander Belser. Dr. Belser is a clinical research fellow and clinical supervisor at Yale University. He's a co-investigator of two studies at Yale exploring psychedelic-assisted psychotherapy to treat OCD and depression. His research with sexual minority people has focused on preventing suicide among adolescents and on the protective role of gay-straight alliances for students. Dr. Belser was also a founding member of the Psychedelic Research Group at NYU in 2006 and is currently an adjunct faculty member in NYU's graduate program in counseling psychology. He has been a researcher on various psychedelic studies for depression, anxiety, OCD, addiction, trauma, and among religious leaders. He's a study therapist for the MAPS MDMA-assisted psychotherapy study and serves as a peer reviewer and has published peer-reviewed articles on the topics such as psychedelic mysticism, altruism, patient experiences in psilocybin-assisted psychotherapy, cancer and psychedelic therapy, case studies, and psilocybin treatment post-traumatic growth. You can find more about Dr. Belser at alexbelser.com or his private practice at Center for Breakthroughs. I love that name for a private practice. It was really fun chatting with Dr. Belser. We first came in contact we spent a week together at a MAPS training for the MDMA therapy. I think it was back in 2016 up in New York, and been wanting to get him on the show for a while. I'm glad that we were able to finally chat and catch up and have this conversation. So some just quick show highlights of some of the topics that we got into. A queer critique of the psychedelic mystical experience, LGBTQ affirming therapy, and also within psychedelic assisted psychotherapy, so how to create a container that's affirming to LGBTQ clients, patients. This idea of retiring the male/female team in psychedelic assisted therapy and moving towards a more gender neutral team, psychedelics and how they can really help change our relationship to our bodies, and then also how current psychedelic research undervalues different types of mystical experiences that have been experienced by queer people, women, indigenous folks, and also marginalized populations, and how also the current research does not always measure common mystical experiences, but seems to focus on the oneness, the void, and this kind of non-dual state. So I hope you guys enjoy this episode with Dr. Belser. I had a really fun time chatting with him, and hope you guys enjoy this. It's just some also news updates, what we've been up to. So Joe and I have we're wrapping up our 5-week course. We have 2 cohorts running. One's for the general public, the other cohort's for therapists and clinicians. So we've been hosting some online Zoom meetings weekly for 5 weeks, and it is coming to an end soon. I don't know when this episode is going to be released, but it's been really fun. It's been really great to connect with people online, spend time with them in the Zoom room. Zoom is just a video conferencing platform that we use to connect with people, and we go through our Navigating Psychedelics course together, and we dig into conversations and just have in-depth discussions to really understand this material. Our course covers harm reduction, safety, preparation, integration, self-care, and it has a bunch of content, and it's been a really, really fun experience, and it's a really great way if you're interested in learning more about psychedelics, you want something that's a little bit more structured and really kind of walk through this material together. It's a really great experience to join the online course and be able to connect with others and ask questions. And it's been fun offering the 2 different cohorts and seeing how the conversations are a little different. And Actually, in the therapist cohort, we get into this a little bit about do we need the male-female teams, and what would it look like to have other teams comprised within therapy. So we're even asking some of these questions in the course, which is really great. And yeah, if anybody is interested, if you're interested in learning more about psychedelics, if you're a clinician therapist or just like psychedelic enthusiast, definitely check out some of our upcoming courses. We have 3 new dates available. One date, we have a new summer cohort, and those are going to be broken up into 2. So we have the general cohort and then the therapist and clinician cohort. Those start in mid to late July. So Wednesday, July 17th, starting at 7 p.m. Eastern Time to 8:30 p.m. Eastern Time. That's when our general cohort starts. And then on Thursday, July 18th is when our clinician therapist cohort starts. And that one will also be from 7 p.m. to 8:30 p.m. Eastern Time. So if you want to learn more about navigating psychedelics, if you want to learn how to walk through integration processes, or even just understand how to support, if you're a therapist, understand how to support a client that might be coming in talking about whether they want to use psychedelics or they have used psychedelics, and just really dig deeper into these conversations and topics. To learn more, you can go to psychedelicstodayshop.com, click the education tab, and then you'll see more information, or you can just go to psychedelicstoday.com and then just under the online courses tab, and then there's different cohorts right there. And then we're also in the middle of our physician course with Dr. Matt Brown. Dr. Matt Brown is teaching the physician's course. Same thing, 5 weeks. We meet in the Zoom room and really talk a lot about what's going on. We've been talking a lot about ketamine, which is really interesting. So yeah, check that out. If you want to support the show, if you're listening and you listen on iTunes or Stitcher, Spotify, be sure you hit that subscribe button, subscribe to our show. If you like what we're doing here, leave a review on iTunes or Facebook. I don't know if you can leave a review on Stitcher or Spotify. Maybe you can leave one on Google Podcast. But yeah, wherever you can leave a review, that'd be awesome. On iTunes and, Facebook definitely helps out with algorithms and stuff. So if you want to support the show, consider leaving a review. We would really appreciate that. Another really great way to support the show is sharing. So share the show, share a piece of content. If you're on Instagram, repost an image, but just share anything that you like from the show on social media. So yeah, go share your favorite episode with a friend or a family member or a colleague. That'd be awesome. And if you want to donate to our Patreon account, you could do so over at patreon.com/psychedelics today. And you could donate $1, $5, $10 if you want. And this just really helps us keep going, pays for our server fees and podcasting, hosting sites, and all that stuff. So if supporting the show in any way possible, we deeply appreciate it and really appreciate the support. And we couldn't be doing this without you. So, to everybody that's listening, to you listening out there, thank you so much for listening and tuning into Psychedelics Today, supporting us, following us, and just engaging with us. It's been an awesome ride, and thank you so much. And enjoy this episode with Dr. Alex Belser. All right, welcome back, everybody, to Psychedelics Today. I'm here, joined with Dr. Alex Belser. Welcome to the show, Alex. Really excited to have you on here.
Oh, thanks for having me on. This is great.
Yeah. Do you want to give the listeners a little background about who you are and how you got involved in psychedelics?
Sure, yeah. I started going to psychedelic conferences when I was in college, back before there were really much in the way in the late 90s and early aughts of published research. It wasn't until, Francisco Moreno's work and then some of the work coming out of Hopkins in 2006, where some of the Renaissance began, or what's called the Renaissance today. I I work at Yale today. I'm a co-investigator on 2 trials at Yale. We're treating individuals with major depressive disorder with psilocybin-assisted psychotherapy. That's with Dr. Jordan Sloshower. And I'm also involved in a trial separately with Dr. Ben Clemendi, treating people with obsessive compulsive disorder with psilocybin. And I was one of the founders at NYU of our psychedelic research group. So I was involved with a trial treating people with cancer with existential distress about their cancer diagnosis with psilocybin. And I live in New York, and I get to work on a team, one of the sites for the MAPS MDMA trial of MDMA-assisted psychotherapy for the treatment of severe PTSD. So we have a site in Lower Manhattan, and I get to be a study therapist there working with people with trauma. It's lovely to be here today. Thanks for having me.
Yeah, rich background and doing really awesome work. I think I was just looking at part of your bio, and you started that one NYU club back in 2006.
Yeah, we started a reading group.
Nice.
We called it PRG, the Psychedelic Reading Group.
I was like, oh, that's when I graduated high school. Just started getting into this at that time.
Yeah, I was a master's student at the time. I was the sort of junior person in the group, and that was with Drs. Tony Bossis and Steve Ross and Jeff Guss. And I just finished a master's degree. I wasn't even in psychology yet, and in part because of that, I decided to study psychology. So my background is in my PhD is in counseling psychology and doing clinical work and research. But I felt like a kid back then. A lot's happened in the intervening 15 years or so. Yeah.
Yeah. Yeah, so, we reached out, we wanted to kind of get you on before the whole Queering Psychedelics event that Chacruna was putting on. But, we're here now, so I figured we could try to catch up and talk about some of the research or the presentation that you presented there. It was called A Queer Critique for the Psychedelic Mystical Experience, and it sounds really interesting.
Yeah, I'd be happy to talk about it. We don't really... So much of the research has been focused on the importance of the clinical work and sort of a high rigor of research. But there was this amazing conference in San Francisco that Bia Labacha and Chacruna really helped facilitate and bring into being, called Queering Psychedelics. And it was a space, a full hall full of people looking at the intersection of what sexual and gender minority people go through in terms of their lived experience and the intersections with psychedelic medicine and consciousness and research. So some really generative conversations. And I'd be happy to share with you some of what I shared in my talk there. But it was one of the first opportunities for queer folks to come together to talk about psychedelic medicine. I had been convening a little LGBTQ meet and greet at previous psychedelic science conferences in 2010, 2014, and 2017. And it was lovely to see a full-fledged 2-day conference committed to that sort of work. So it was lovely to be in a room full of people bringing their perspective and experiences. So we talked a lot about the controversies of power, representation, accessibility, equitability in the provision of psychedelic medicine to disadvantaged, marginalized, and oppressed target group populations.
Yeah. We were promoting a little bit of it, and we had some really interesting feedback on some of our Instagram threads and whatnot with this conference. So I'm curious, why was it important to put on a conference like this? Because there are some people that were like, I don't get why separating queers from psychedelics shouldn't it all be one. But, from my perspective, I don't think people really understand what's been going on in the research world and just the psychedelic community in general, where it is kind of mostly white men kind of like doing a lot of the research, straight white men. And yeah, there are these kind of marginalized groups within this community, and I'm sure in academia as well. And that's something that's not always addressed. And it seemed like that was kind of why Bia and Chacruna put this conference on, was to kind of have this conversation. But you can correct me if I'm wrong.
No, I mean, well, I identify as a gay man or a queer man, but I have so many intersecting levels of privilege as a white cisgender man, and I have passing privilege, meaning that many people perceive me as straight. In the psychedelic world, when you take a look at it in terms of the research community, we need to think about how knowledge is generated. And if you take a closer sort of criticalist look at how research is generated, the psychedelic research community inherits much of the sort of structural disadvantages that come out of standard research, which is that people in positions of privilege have more power, they have more access to funding, they have greater access to sort of advancing the research agenda. So one of the reasons we needed this conference was to think about and how to confront structural heterosexism and transphobia at every level within the psychedelic community, and to really do our best to divest ourselves of it. I mean, there is a predominance of white, straight, cisgender male researchers, and these are my colleagues and friends, and many of them are using the privilege, I think, for good, and I applaud and am so grateful for the contributions that they have made and are making. And yet, I think that we can question why it is that we don't see more people of color in positions of power, why we don't see more queer primary investigators on these trials. We need to look at funding structures and research priorities. And it's only recently that we've even been assessing for sexual identity or gender identity or people's pronouns in these psychedelic trials. And I think, and even so, that's not standard research practice. So we need to take a look at the lack of LGBTQ patient-centric approaches. And this applies to sexual and gender diverse people, but it also applies to a variety of other oppressed groups and marginalized populations, whether it's indigenous folks, the global north-south divide, Black and brown people in POC, poor people, rural individuals. I mean, the psychedelic research is coming into a late adolescence where we're getting more mature and need to start thinking about broader issues of inclusivity, equitability, and power sharing.
Yeah. Why do you think there has been a split? Like, I guess I have my own opinions about like inclusivity and maybe why marginalized people haven't been able to get involved in, say, academia research and all this stuff. But I'm curious.
What are you thinking?
I think largely part like the privilege of going to school and taking out loans and kind of like that hierarchical system, right? Like if you're constantly in like survival mode for some marginalized people, it might be hard to kind of escape that and enroll in programs and step into these other positions. And on the research front of having people included into the studies, kind of the same thing, right? Like we've talked to plenty of people about this, of who's got time to maybe take off 2 days of work when they're in survival mode and they need to work pretty often to be included into the research.
Yeah, it's a major point of privilege, just in terms of your ability to put in the time. But there's also like very specific things that are sort of old canards, I think, within the psychedelic research community. So, I mean, one of my recommendations is that we need to retire the idea of the male-female dyad and replace it with a gender-neutral or gender-affirming dyad. And, I appreciate some of the psychological and psychiatric, psychoanalytic literature regarding transference from the patient. So there's this idea with psychedelic therapy that the patient comes in and it's important that they work with two therapists and that there's a cisgender male therapist and a cisgender female therapist. And this has been more or less the standard for a long time. But it's really gender essentializing. It has this idea that the sense of masculinity is held by the male therapist, and that some sort of stereotypical femininity is held by the female therapist, and it's totalizing of gender. We need to move towards a more gender neutral and client specific approach. First of all, it doesn't make room for trans people or gender diverse people as clinicians, and then for not just trans and sexual minority individuals who are clients, who are participants and patients who come into psychedelic research, this idea that there's a sort of mommy daddy there for you to do the work can be quite powerful, certainly to have a sort of a gender mix in the room. But it denies the ability for a cisgender male therapist to have stereotypical feminine qualities of holding space or being nurturing. It also denies, or at least makes it more complex to think that a woman therapist might have more stereotypical masculine qualities of being authoritative or taking a leading role in the sort of the work that's happening. And I think that it propagates really harmful and even injuring norms around gender, not just for queer and sexual minority people, but for straight folks as well. Now, people will argue against this. They'll say, well, you really shouldn't have a male-male therapy team working with a female client. What if that client has a history of sexual abuse or rape? And my sense is that these are all individual. It's essential to assess the individual needs of your client. If there is a reason to believe that the person would do better with a different sort of gender pairing, then make that determination. Either refer out or assign them to a different team. I mean, at NYU, we've worked with male-male and female-female therapy dyads in the past. And I'm happy to say that the MAP study in the latest iteration for the MDMA research has moved towards gender-neutral therapy dyads. They're no longer requiring a strict male-female therapy. Awesome. And so I think that there's a lot of reflection going on here, but yet there's still a sort of sense that this is important. And I think it's time for our theoretical and clinical orientations to move beyond a 1950s to 70s understanding of gender. I've worked with many clients in both psychedelic therapy and outside of it where their understanding of their identity changes. And when I say identity, I mean their sense of their gender changes, their sense of their attraction might change, their sense of their masculinity or femininity may change. And I think it's important that the structures, the clinical structures and theory that we put in place reflects an openness to people being able to change. We know that gender is mutable and that the clinical structures that we put in place can reinforce a type of strict gender binary or could be more open to a more complex understanding of gender. And I do believe that the psychedelic experience can bring that on in people. And I think that we should support that wherever we can.
Yeah, that's awesome that NYU is experimenting with other teams. This is something that's come up a lot in conversations, and we were actually talking about it in our Navigating Psychedelics course for the therapist cohort that we're running, and this came up. Is this going to be just male-female teams, and could you experiment with male-male or female-female or other gender and it's like, yeah, why not, right? I think it's almost kind of like Freudian in the sense of it has to be this you got to do this work with the male or you have to do this type of work with the female. And it's interesting.
Yeah, I mean, it's Freudian, but there's decades of feminist and queer literature and scholarship and clinical scholarship on this issue. And the psychedelic community, I think, is just sort of catching up a little bit to it. And I'm not arguing that there aren't potentially needs for specific gender pairings with specific clients, but that should be a client-specific consideration rather than a blanket rule that prohibits other sort of gender pairings in the room. And I think that that's where the trend is arcing toward, and I think that's a good sign of progress.
Yeah, safety first, right? Maybe seeing what would work best for the client, and make sure that they feel comfortable with that pairing.
Well, absolutely, and we know that intimate partner violence and sexual trauma is experienced by cisgender male and trans folks at high levels as well. And so gender assignment should be considered there in terms of what the client's experience of female therapist pairings may be. These are really complex clinical matters, and that's why it's important to know the client well enough when considering therapy assignments. You need to do the initial groundwork and assessment so that the person feels safe. and that a container of rapport and trust is established so that the client can feel like they can reach out and hold the hand of the therapist if they need support in the moment. And I think that's really critical.
And is that something that clinicians are asking before doing these sessions, during intakes or assessments? Like, who would you want to be matched up with, if there's like an optimal team of therapists that you could work with? Or is this just really new and still trying to navigate all this?
Well, certainly in any given team, pragmatics sometimes play a role. I mean,
right.
There's very few studies that have enough clinical staff on hand that they can offer any variety of gender pairings. And it's not just gender, right? It's also about people of POC, sometimes having preferences to work with POC, people of color, clinicians, and other sort of social locations. What is happening, though, is there should be a sufficient clinical history taken, including a history of people's any sexual abuse or trauma experiences, to understand how gender might play into that. And that should certainly be part of any sort of psychedelic-assisted therapy work before the work begins.
Yeah. Awesome that you guys are thinking about this, right?
Yeah.
Cool. Yeah. Do you want to jump in a little bit about your presentation at the Queering Psychedelics?
Yeah. Let me just share some of my other points. I mean, sure. I think that, I came out with 10 recommendations, and the first was to confront structural heterosexism and transphobia. The second was to retire the male-female therapy dyad. And the third is just an acknowledgement of the psychedelic world that sexual minority stress, this extra stress that LGBTQ people face, causes disproportionate harm to LGBTQ people. So sexual minority folks have 2 to 4 times the rate of depressive, anxiety, and panic disorders, problematic alcohol use as compared to their straight peers. And for a long time, this was thought that's because gay people are pathologized. I mean, this was a DSM diagnosis for the greater part of the 20th century. But we know consistently through research that the problem is not sexual identity or gender identity. The problem is the additional messages of stress, structural stress, what we call sexual minority stress, that LGBT people are exposed to over the course of their lifetimes, from the experience of knowing that you're different when you're young, but being unable to talk about it, experiences of profound family rejection, experiences of bullying and victimization and violence in school, on the playground, in the streets, experiences of workplace discrimination, the stress of the closet and concealment of one's identity. These studies show time and time again that this causes biological impairment in terms of increased cortisol levels, and that this is what mediates the relationship to the higher rates of depressive and anxiety disorders. And I think what we as a psychedelic research community need to think about is the question of what works for whom. We need to be able to move toward an LGBTQ affirming psychedelic assisted psychotherapy, so that we need to test whether or not our current treatments, for example, actually work for minority populations. So, the first step is to actually assess for that. But then we should be able to, in all of the psilocybin and MDMA and other trials that are happening at Hopkins and NYU and Yale and UCLA and Imperial, we should be able to run, if you let me get nerdy for a second,
totally.
Stats geeky, you need to be able to run moderation analyses to see if that psychedelic treatment works the same for the sexual minority people who do it as it works for the straight people. So you need to have, and we could, if we wanted to, run meta-analyses or pooled analyses across studies to see if the treatments work as well for sexual minority populations as for straight folks. And we've been calling for this with racial and ethnic minorities, but I think that it's important to assess for gender and sexual minority status so that you can actually see, if you're doing trauma work, right, with MDMA, it's important to know if that works in the same ways, or are there unique pathways of healing, pathways of victimization, unique clinical considerations that should be taken into account for gender and sexual minority people. And if that's the case, we need to start thinking in a really profound way. And we see this in mainstream psychotherapy. In mainstream psychotherapy, there's a big movement in the last decade towards what we call LGBT affirmative therapy. So you're familiar with like conversion therapy, which is sort of the total opposite of this, where we use therapy in a bad way to try to convert people who have attraction to the same-sex partner, convert them to becoming heterosexual. And that's been ruled unethical by the APA and by a variety of licensing boards. But this, by the same token, it may be that, and we see this, and this is part of my postdoctoral research at Yale, it's important to develop therapies that address sexual minority mechanisms directly. And these mechanisms are unique. So, we see oftentimes with gay men, the lifelong experiences of rejection lead them to be the best little boy in the world, a sort of compensation strategy to be helpful and kind and to be an A student throughout their academic years, and to try to, their sense of inner worth has been confirmed as being full of shame and self-hatred because of their sexual identity. And so oftentimes they'll adopt a compensation strategy to be good and smart and well-liked and helpful to people. But this perfectionistic behavior can serve them sometimes, but also in therapy comes up as a specific thing to work on because it's exhausting to maintain that, and it denies a sort of profound self-compassion. This comes up in MDMA work. This comes up in psychedelic psilocybin work. And it's just one particular pathway we can look at. So I think that we need to start developing LGBTQ affirming psychedelic assisted therapy. And we could do this through qualitative research where it would be of, by, and for queer people. We would interview queer clinicians who have experience working with queer clients. We'd interview clients themselves who've undergone psychedelic therapy and related therapies. And we would come together to develop a type of approach that would be specific to the LGBTQ experience, which is oftentimes like a primary theme in people's therapy work. So why would it not be a theme in their psychedelic therapy work?
Right.
We could put together a pilot trial, and then we would do a randomized controlled trial of the LGBTQ affirming psychedelic therapy versus generic psychedelic assisted psychotherapy. And in doing so, we could identify unique stressors and mechanisms and treatment pathways for sexual minority and gender minority people. Anyway, that's a big mouthful, but we're coming at a place where the psychedelic renaissance has been in sort of an early phase, but I think that we're getting to a point that we need to be able to have population-specific approaches, and a certain sort of maturity comes with that, both in terms of our methods, our clinical approaches, and our statistical findings and approaches. And I think we're arriving at a place where it's time to think really strategically about how to proceed with that.
And are you trying to conduct any research with this? Or are you in the process of putting anything together to really analyze this and come up with like a new protocol or anything like that?
I have been talking with some people who seem to be really interested in this type of work. My work right now has been less focused on LGBT populations, but I have been advocating to get just basic LGBTQ affirming practices, like asking people about their gender identity and sexual identity and pronouns, and to have that sort of training and awareness among clinicians. And I think that my next step is to try to get a standard assessment measure into all of the clinical trials so that we can run meta-analytic studies across different psilocybin and other trials to see how it works for sexual minority people.
Yeah. What would you say to somebody that would say, like, why would you need these separate types of, like, I guess, therapies in the sense of, well, not separate therapies, but maybe just different approaches or one that's more specific to the LGBTQ population.
Yeah. I'll give you an example. I mean, it's not uncommon when you don't have these approaches for a client to come in, you give them a 2-hour assessment, you get their whole background and history, and you really start to know them, and you work with them and you work with them. And then you could be weeks or months in as the therapist in the room and not know what their gender pronouns are. This happens all the time. We just sort of assume that we misgender people and say, oh, she's a she, he's a he. But you could get deep into a psychedelic trip and realize that the person has been anxious because they actually use gender pronouns of they and them, and never, and have that never been asked. And so in doing so, there's a sort of implicit assertion of a cisgender privilege where we just assume that people who read as male in your eyes will use he and him pronouns. That is a type of propagation of heteronormative and transphobic violence in the consulting room. And it has profoundly difficult implications and potentially harmful implications for trans and queer clients. That's a pretty clear example of this. We see this in underground communities too. There's tons of anecdotal reports. We see this in ayahuasca communities of reports of some churches like the UDV coming out with complex statements where they'll that seem to be quite unwelcoming and intolerant of sexual and gender diverse individuals. There's plenty of anecdotal reports of people participating in circles in underground or in other countries, communities and settings where they don't feel like they can tell the people in the circle that they have a same-sex boyfriend or girlfriend or partner, or they don't feel like they have to still conceal a part of themselves. And then, the last thing I'll say about this is that I think that it's helpful to straight folks to include this sort of information. We have a lot of people who may never have explicitly thought about their attraction. And there's tons of anecdotal reports of people taking a psychedelic like LSD or psilocybin and coming to a place where they're thinking about their gender and sexual identity and thinking, maybe I'm not 100% straight. Maybe I do have some implicit affection, affiliation, attraction to people of the same gender. This happens all the time. And there's a sort of joke, really, like that psychedelics make you a little gay. And it's a joke and I use it flippantly, but I think there may be some truth to the fact that we all suffer, including straight folks, in a world where the idea of gender and sexuality is like firmly printed as either being A or B. And this is a disservice to our identities. And if psychedelics are truly mind manifesting, and that if the mind is a large and beautiful sphere of spaces, it may be large enough to include a different type of relationship to same gender, same sex individuals. And I think psychedelics open that up. I've seen that in our clinical work with patients where people's sexual and gender identities shift or become mutable. We know that they are not fixed. We know that they can change. And we should expect, with the power of these treatments, that they may change for people. And I think that it's important to have an LGBTQ affirming treatment, or at least training and sensibility among the therapists to be aware of that people, otherwise 100% straight person, may be confronted with material that's really difficult, that's scary to them, that they may resist, that they maybe had a crush on their teenage best friend that they've never even admitted to themselves, and be able to encourage them to share that in a safer way, and to explore that in a place that feels open in the psychedelic integration sessions. And I think that's super important. And I invite my therapist friends to think about that kind of work.
That's really interesting. And I wonder, that'd be actually an interesting kind of like study to undertake, like to see how that's shifted for people in psychedelic experiences. Because, I've definitely talked to various friends and, people I've just run into talking about psychedelics and what their experiences are like. And that is kind of a common thing that has come up, or at least I've chatted with people where it's kind of common to be like, oh, like, I felt one with somebody and I felt like, the gender didn't really matter at that point. And, I felt myself get in touch with this other part of myself that I didn't know was there. And so it's really interesting. I wonder how common that is for a lot of people.
Well, we don't know.
Yeah.
Right.
Yeah.
So one of my recommendations is that we should formally assess sexual and gender identity, attraction, and sexual behavior, as well as internalized homophobia, which is a standard measure. We should assess this both before and after psychedelic studies. Do these things change in some way? And even for straight folks, we all harbor internalized homophobia. It's impossible not to in our society, or internalized transphobia. Does that change? We know from naturalistic studies that people who use psychedelics are less apt to be violent with their intimate partners, that IPV, intimate partner violence, is less. Might we imagine that people who take psychedelics somehow uproot some of their internalized homophobia and disinter their internalized transphobia? And even if they themselves are not somewhere by or somewhere on the Kinsey scale, like maybe it makes us better, more compassionate, more tolerant, more accepting people. And I think we can measure this formally. This is a research question. It has a theoretical implication, but it's a research question that we could add on to all of our studies at very little burden in terms of assessment.
Right.
It doesn't sound like a long questionnaire.
Yeah. How do you identify, maybe like just some post questions on, did you have any thoughts about this, or how has things shifted? Be really interesting.
Yeah. I mean, and the last piece of this, and this is not about identity per se, but it's about, we should be pursuing sex and sexuality research. We need to incorporate the physical body, our sense of sensuality, our sex and sexuality, and our research and in our praxis. And that includes things like attachment theory and our deep relationships with people, which is part of the corporal body experience. In my interviews, I've done long form interviews with patients in a variety of our studies, in the cancer psilocybin trial and the religious professionals study. And the body and the relationships, both to their body and to other people, are consistently themes in the work. And I think that, I'm a little hesitant to use this word, but I think that the psychedelic research and largely clinical research across the board is pretty sex phobic. We don't really want to acknowledge that we are, that sex and sexuality is a big part of people's identity and lives and lived experience and their attachments to their partners and husbands and wives. But people in the psychedelic literature, in the interviews, they talk about the body. They talk about the relationship with their body. Some of that is that their identity goes from being a tiny speck of consciousness that they carry around in their skull, right, in the sort of soup of the brain, and it can, the wall of the ego can be expanded, at least for a time, pushed out to incorporate the full body, right? And even from there, it could be pushed out further to be in the room, or to be aware, or to be identifying with other people in the room, including the therapists. And so this sort of ego dissolution event is not uncommon. And some of it is reclaiming the body. I mean, people hate their bodies, right? We're taught by our culture that you're too fat, you're too thin, you don't have the right muscle mass. Boys and the sort of are taught the sort of Adonis physique, that you have to have a certain type of musculature to be attractive. Women, we get the sort of bikini culture. We have so much apprehension and anxiety about revealing our bodies, our nudity, about sex with our partners, about what the implications of sex are. I work with gay men all the time on how they use sex as a validation mechanism to have sex with people, because they feel that their internalized sense of self-worth is contingent upon their value because of their body. And what's interesting about plant medicine and classical serotonergic psychedelics and even MDMA is that it can change your relationship to your body. It can help reclaim the body, not as a source of shame, but potentially as a place of pride and the seat of consciousness in some important way. And I think that it's important that we look at the ways that our current research can be a little sex and body phobic. And, with good ethical guidance, like think about these questions in a more comprehensive manner.
Yeah, that's huge. I mean, I don't know. Maybe I'm a little biased thinking about focusing on somatic psychology and thinking about the importance of the body and how so many of us are kind of detached from it, right? Either thinking about, oh, doesn't look good, or maybe I don't feel good in my body. Whether that's how much marketing and advertising really plays into how we're perceiving that, but also, culturally, we live in our heads so much, right? We're a very cerebral type of culture, and it's almost like we kind of disconnect from the body at times.
Right, and there's a whole strain of thinking in the psychedelic literature of the last 60 years that this is potentially medicine to get out of our heads. I mean, not just into the transpersonal, and not to be tongue-in-cheek, but sort of interdimensional consciousness, expanded consciousness realms, but to get out of our heads and into the physical space of the body. And that has a profound spiritual implication. Part of my talk, and we probably don't have time to get into it, is about thinking about the queer spiritual literature, which is about a reclamation of the body. And a lot of queer spirituality comes out of the plague years of HIV and AIDS in the 80s and 90s, before antiretrovirals came on the scene and HIV was a death sentence. So ACT UP was a political movement, and queer spirituality and queer liberation is associated with power and politic, but also a politic of the body. Like the actual dying body was a sort of iconic trope of both the queer political liberatory scene. And psychedelics are oftentimes described as a confrontation with death, not just a sort of rehearsal of ego dissolution death that some people describe. But part of coming back is coming back into the body, or coming back into the mind if you're alienated from the body. And so, when we look at, and you were talking about somatic work, when we look at non-psychedelic therapy, sort of related fields like somatic experiencing, which is a trend in different approaches in clinical psychotherapy, to be aware of what's happening in the body, to how people carry trauma in the body, to how people experience feelings in different parts of their body. And so we get sort of mixed modalities. I mean, holotropic breathwork, Hakomi, somatic experiencing, all of these mix traditional psychotherapeutic techniques with corporal, somatic, body, physiological attention and awareness and work. And, psychedelic journeys are oftentimes very physically intense. It doesn't necessarily have to be the purgation experience of ayahuasca. I mean, psilocybin and MDMA are also physically intense. And I think it's potentially, these are not side effects, these are not unwanted bugs in the experience. I think that these are potentially features in the experience and novel pathways to healing. And we should think about them and how they can benefit our clients, how they can benefit people working in this way.
Novel pathways of healing. What do you mean by that? The different somatic sensations that come up within these sessions? Yeah,
so there's this ongoing question, what caused, how do psychedelics work?
Right.
A really basic question, right? And so if you're sort of a hard scientist, and I don't mean to dismiss it as a positivist or reductivist mechanism, but there are all these neurobiophysical mechanisms, right? So we have classical serotonergic hallucinogens are active in the 5-HT2A receptors. They affect AMPA, BDNF levels, neurogenesis. They increase functional neuroconnectivity in the brain. They have anti-inflammatory effects, which are both acute and global. And all of that's wonderful, but honestly, I think the jury is still out on the mechanism of the novel pathway of healing for how psychedelics work. The leading psychological mediator or pathway is what's called the complete mystical experience idea. And this is a measure, the mystical experience questionnaire, that says, basically, did you have a mystical experience? Did you have an experience of profound unity, of positive mood, awe, and amazement, of transcendence of time and space, and ineffability? And we find that when people score higher on the mystical experience questionnaire, that is predictive of improvements in their depression, of improvements in their anxiety. And it's also been correlated with a few other clinical symptom improvements. But the problem is when you actually look at the measure, it only explains a fairly small percentage of the variability. So, for example, in one study, the mystical experience questionnaire, if you had a complete mystical experience with psilocybin, it does lead to improvements in depression, but it only explains 13% of the variability in the depression score, which means that 87% of the improvements, of the change that we see in our clients, is not explained by this mechanism. And so I think we need to be open theoretically and in terms of our methods to other pathways of healing. This is not a single pathway approach. I think that psychedelics are complex and idiosyncratic, and there's probably multiple different pathways to healing. And I think some of that could be body-based. I mean, I think people have experiences in and of the body. And we saw this with our cancer patients, where people had a fear of cancer, and they had visions under psilocybin where they felt like their fear of cancer was erupting from their body like a black mushroom cloud. Wow. Or that they could shake their arms and had this like dark mass that was accumulated throughout their body, aggregate through the arms, through the forearms, falling down into the fingers. And as they shook their fingers, they could feel it leaving out the tips of their fingertips. So they're expelling, or there's a pushing out of maybe not just the cancer, but their anxiety, their distress and fear of the cancer. But it's experienced through bodily somatic processes. And that's not being assessed on things like the mystical experience questionnaire. But we need to start thinking more comprehensively about how psychedelics work. And so there's a sort of, I'll give you an image, right? There's a sort of black box, there's a black box. People take psychedelics, they go into the black box, something happens, and then oftentimes they get better on the other side. But what is this mystical black box? And I think we need to unpack the box and start looking at all the potential mechanisms. And there might be many dozens of specific empirically validated processes by which people improve with different medicines and with different indications. And so I think it's time for us to get a little bit more mature in our research questions regarding this. I think the time is ripe for that.
Yeah, really interesting. I was looking a little bit at your abstract for the chacruna thing, and that was something that you brought up and I wanted to ask you about, was the current research doesn't measure the common mystical experience, such as voice and visionary experience, pain and suffering, ecstasies, creative expression, spiritual longing, and friendship and compassion. And yeah, I was wondering, like, how else, I guess what's missing out of this mystical measure, and like how could we maybe incorporate other aspects into it, or other pathways?
Yeah, it's a hard question. I mean, and it's a big question too. I mean, part of the thing about, and maybe I imagine this is one of the reasons you might really enjoy doing the work that you do, which is talking about psychedelic medicine and consciousness is a very multidisciplinary approach, right? And there's no way to do it. There's no way to do it and be a specialist entirely in it, because if you're a specialist as a clinician and as a psychological researcher, you don't have a PhD in comparative religious studies, right? You may not have this sort of background in theological discourse to understand the sort of mystical experience questionnaire. So we have people that are veering into lanes of scholarship that they are just learning about. And I'll admit my own lack of training here, right? Like, so I consider myself a curious person in a variety of different fields, but I'm no expert in the mystical scholarship. My understanding from a psychological perspective is that there are basic critiques that we could make of a mystical experience as we've described it currently in the psychedelic literature. And the mystical experience questionnaire privileges a type of mystical experience that I could describe as monistic mysticism, meaning you have the individual has a sort of qualityless experience of the real. Sometimes it's called the void. And W.T. Stace, the sort of scholar who put this together, this is consistent with Aldous Huxley's idea of the perennial philosophy. It's consistent with Advaita Vedanta in the Hindu tradition. And it's about a qualityless experience, this idea that you have a mystical experience which has neither form, nor taste, nor color, nor smell. And anything else he calls these borderline cases. But we have a whole history in mystical scholarship, especially with women authors like Evelyn Underhill, and even in the Christian tradition, saints like Saint Teresa de Avila, who have these experiences of God where they have it's not qualityless. They have an experience with a theistic duality. Saint Teresa de Avila is sort of pierced in this ecstatic and highly sensual, sexual way by God. We see in sort of nature mysticism or in Pablo Amaringo's paintings the sort of colorfulness of many of the visions that people experience. So even in our NYU trials with the cancer study with psilocybin, people were visited by people in their lives. They had visitations of their mother, their father, ancestors, people who were deceased, who came to them and acted as guiding spirits. They called them angels or spirit guides, like Virgil guiding Dante. And they had these profound colorful visions of sight, sound, synesthesia, people having experiences in their body with the music and people having visions concordant with the music that seemed healing and profoundly spiritual for them. And my sense is that this sort of very narrow conception of a monistic mystical experience of the void, where it's sort of like the lone atomistic individual experiencing all of reality, is useful to an extent, but to put that as the crown jewel that sort of is higher or a higher sense of spiritual experience than all of these other experiences that we see is potentially pejorative and does a disservice to the power of other types of experiences. And it privileges a type of measure coming out of specific traditions. If we actually look to the psychedelic clinical experiences, we find that we should be building our questions from a bottom-up approach, what we might call an emic approach, where we actually interview people who do psychedelic work as clients and understand the quality and nature of what they experience, and then build measures around that. Instead, what we've done is we've taken a measure that was designed for a sort of Advaita Vedanta non-dual, quote unquote, non-dual experience, and just wholesale imported them into psychedelic research and sort of plunked them down. And it's a decent fit for some people, but it's probably not, but it's a start, but probably not the best way to do it. So there's a whole feminist, criticalist, queer critique that we can make around spirituality, right? That we privilege certain forms of spiritual experience, but we disadvantage other forms of spiritual experience. And oftentimes those tend to be by marginalized people, by women, by people of color, by queer people. So I think we need to be careful about what we value and what value and positions we put on people's spiritual experiences.
Right. And then I know that was another point that you had in there as well, that the current psychedelic paradigm undervalues these types of experiences by queer women, indigenous, and marginalized people. And I'm curious, like, what type of experience would you say that entails with, like, spirit visitations and stuff like that? More moving away from that, like, non-dualistic state?
Well, I think that we don't have to look far. You know, the one way to think about it is, I mean, there's a big question about what non-dual is, right? So one sort of line of thinking, as I understand it, is that oftentimes people do experience a profound feeling of oneness, a profound unitive experience with psychedelics, and this is potentially the apogee, like the sort of pinnacle of the sort of self-realization experience. But there's another strain of thinking, which is that in order to have a truly non-dual experience, we need to experience and understand the true multiplicity of all things in a profound and profound eschatological sense, that the sort of dialectic between the true oneness of all things and the multiplicity of all things, between the world beyond and the world of illusion that we may find ourselves in, that some combination of form and non-form is the truly non-dual experience. And we see consistently in people's own tellings that they see visions, and you don't have to be from an indigenous culture to see this. I mean, our lab is on First Avenue in Manhattan. It's a big city. We're working with primarily fairly well-educated professional people who don't have a strong background in animism or paganism or shamanistic techniques, but they report seeing things like a gorilla face, a horse's eye, seeing two serpents, two colored cow heads, people having visions of a blue placid lake and encountering a ferryman, a boatman wearing all white on the sandy shore that is sort of acts as a sort of guide. We see people entering into three-dimensional chessboard worlds. We see people hearing from people entering a roller coaster with hills and valleys with multiple colored cars. We have people giving accounts of flying through gaudy cathedrals. And so, people are having like really rich experiences that have form, that have color, that have sound. And in some ways, I think the jury's still out on what this means, right? I think that we need to be open to a different type of approach. And some of that is just acknowledging a type of that attainment to the one is potentially merely a first step toward non-duality, and that attainment of the many is a significant other preliminary dialectic.
Why do you think these experiences are undervalued and like the goal is for this like kind of Godhead non-dualistic experience? Why are we so focused on that?
Well, I think that there's been a privileging since Ellen Longer and John Kabat-Zinn and the sort of like importation of Eastern spirituality from the Beatles on, of a particular type of Western fascination with mindfulness, meditation, and the idea of enlightenment. And I don't think that this is bad. I myself have been sort of in this area for a long time. But in doing so, not to orientalize the discourse, but we have imported like a particular type of Western fascination with the idea of attaining to oneness, of attaining to a type of self-realization, experiencing the suchness of the world. And in doing so, there's this other strain, which is a sort of other wisdom path of indigenous medicine doctor, plant medicine healing, what is sometimes called shamanistic practices from multiple world cultures around the world that isn't just about a particular strain of a particular type of Theravada or Mahayana Buddhism. And even if you look into Mahayana Buddhism, these are like from the Bon religion, these are profoundly like embedded in folk traditions in many ways. And so the forms are important in some way. And in the West, we have this sort of fascination with meditation and stillness as a path toward the goal. But oftentimes we have omitted other practices, what I think of as ecstatic practices, Dionysian practices, the practices of the drum, of the rattle, of ecstatic dance, of plant medicine, of body mortification, of the Lakota sun dance. This entire sort of line of human practice across cultures is sort of still seen as dangerous and marginal and scary, as ecstatic. And we're much more comfortable as Westerners sort of like buttoning up our shirt and sitting down on our mat and trying to be still and quiet for a moment. And there's an entire discourse about how this is potentially pro-capitalist in a certain way. But I think that the oblivion states of the Dionysian, the ecstatic reclamations are scary. I think that they are more difficult for us to incorporate into a sort of late liquid capitalism that we find ourselves in. And sort of the Western sensibility has been a little bit more apprehensive about studying these sorts of things. And I think it's one of the reasons why in the West we have been so apprehensive about psychedelic medicine, because it can be a type of ecstatic experience for people. It has great power in it, as by people's own report. And so I don't know, but I love talking about this with people. And every time I bring it up, people add some nuance or shade to the questions that they're asking. And so I think that we don't know how to talk about spirituality in the West. We've embraced a sort of secular discourse, and we see this with the child molestation scandals in the old Western churches of the Catholic Church and others. And so a movement towards sort of a secularized spirituality. We see this in a sort of a secularized yoga, where the asana practice is prioritized, but the other types of yoga practices, the other limbs of Patanjali, are not really part of the what happens when you pay for your monthly pass and go and do a bunch of exercise. And so I think we have a hard time creating common language and discourses and communities to have not just conversations, but true practice with this sort of work. And I think we have a lot to learn.
Yeah. A word that kind of came up when you were describing that, you were talking about the danger, and I was thinking about the Lakota Sundance and some of these other techniques that could be dangerous, right? A word that kind of popped in my head was embodiment. Really using the body as a way to access these different states. It's interesting. I don't know.
Yeah, and I don't even know if we know what we mean when we say embodiment. It means so many different things to different people.
Right. Yeah.
But so much of the, even in my regular clinical practice working with people, the most consistent thing they tell me is they feel stuck. And part of that seems to be an alienation from the body, or a sort of lack of integration of the body. And so I think that there is a craving, a desire for a type of embodied experience, not just in psychedelic work or embodiment when you're having sex, or embodiment when you're sitting at your computer terminal workstation on the QWERTY keyboard, but like, how do we live as living, breathing beings in these bodies? And these bodies are hallucinogen generating machines, right? We know that we're living in a world of perception where we are translating that into a type of an inner experience. But the mind is creating this powerful experience for us based upon some sort of sensate reality. And so embodiment, the tradition of Cartesian, I think, therefore I am, is this a priori type of world is oftentimes where the Western canon comes from. And I think that psychedelic medicine encourages, and some of the appeal, I think, for many people, is that there's something quite different about it, and quite deeply embodied in a variety of different domains.
So we're coming up on an hour. There was something that I wanted to come back to. I wanted to ask you a little bit earlier. And this is just kind of like general advice / tips for people that, you mentioned about people, say, joining ayahuasca circles, underground stuff, and maybe the facilitators in the group aren't addressing, how people are identifying and pronouns and kind of, really holding that space. Do you have any advice on how to be, I guess, more open to this or get a little bit more education around this? Because it's an interesting topic, right? I mean, like, being in the counseling field, I feel like we get education around it, but it's still even a practice for therapists to come in and practice some of this stuff in the therapy room. And so, I think it's an issue possibly in the psychedelic world, but also in traditional therapy and counseling as well. It's still this learning process. So I don't know. Do you have any advice on how we can become a little bit more inclusive and maybe just a little bit more educated about how to hold space?
Yeah, I think that's a huge question, and my recommendation is to ally and get intersectional, and that involves divesting ourselves of coming to terms with our own internalized homophobia, transphobia, and racism. We need to get an ally with people across different social locations. This is not just race and ethnicity and sexual and gender identity, but class, indigenous status, immigration status, and disability. These are target groups that are exposed to oppression. And I think that together we learn from each other as clinicians, as friends, as family members, how to dismantle types of patriarchal, homophobic, and transphobic structures. And these structures are oftentimes colonial imports. I mean, we might see this in ayahuasca circles, that sort of a Spanish patriarchal culture may influence some of the queer people's experiences of this space. And it's to all of our betterment. I mean, if you look at the literature around masculinity, right, what it means to be a man, the different types of masculinity, there's a lot of discourse around toxic masculinity, but there are different ways of being a cisgender man in today's society. And thinking about gender, getting training on LGBTQ affirming approaches to therapy, doing encounter groups, talking with people in a curious and open way, educating yourself, not just putting the onus on the target or oppressed person to educate you, but rather to educate yourself by doing the readings, by joining groups that you may otherwise not join, by active listening, is powerful. And it's a reflective process to acknowledge one's own places of privilege, and to think structurally about how one can be a better ally across the different locations. And I think that one of the hard things with psychedelic research and practice is that we're thinking about equitability and access issues. Like MDMA expanded access will probably be a very expensive intervention. We're talking about something like 80 hours of paid psychotherapy. Most people will probably not be able to afford it in the first glimpse. And so we need to think about our types of privilege, and the structures by which we propagate these medicines, and just access to mental health care broadly. I think any research and knowledge generating paradigm needs to have a power analysis in it. And it's not just about diversity and inclusion. It's about like a really, strong allied look at the ways in which the structures of power create disparities for various people at every level. And I think that many people are doing that work, and I applaud and salute them, and hope to be among them. And you can do this no matter your social location. So I welcome people to ally with one another.
You brought up a point that I just want to highlight. I'm curious if you have any opinions or insights on this. You said MDMA, the price may be way out of the reach for most people. Is there a way to reduce that or make it more accessible to people that could not afford this therapy if it moves into expanded access and becomes legalized for therapy?
Yeah, I'm part of a team of 8 psychiatrists and psychologists and clinicians in New York. We're starting a sanctuary that we're calling Nautilus Sanctuary, which we intend to be a psychedelic research and clinical practice translational center, meaning it's a place where people can come to do this work. And part of that is we've been thinking critically, like, how do you make this type of work affordable? The current price point is going to be quite high. And I think that there are various ways of doing this. I mean, first of all, we need to find ways to get insurance carriers to consider paying for this if it turns out that the research suggests that ketamine or psilocybin or MDMA may have antidepressant, anti-anxiety, healing properties for PTSD. Then, insurance companies should pay for these because it may, even though it may have a costly price tag up front, it could be quite cheaper for the culture as a whole and for the insurer to pay for a good healing therapy rather than ongoing medication management for months or years. The second major thing to think about is, from a financial model perspective, is can we do group therapy? Any clinician who's done regular conventional group treatment knows that the group is a powerful milieu, that individuals in a group oftentimes benefit as much or more than an individual treatment with one therapist. And most of the trials to date for psychedelics have had a ratio of 2 to 1, 2 therapists to 1 client, 1 participant. And there's very good reason for that. It maximizes treatment effect, and I think it's a great efficacy study to figure out how to do this treatment the best. But there is a way to look at the group process, and we see this work coming out of UCSF, where there's a group component both before and after the psilocybin sessions for long-term demoralization in HIV and AIDS survivors in San Francisco. Dr. Brian Anderson's work on this. I think that any future treatment should evaluate the option to have a different ratio, where you could have potentially a group of 5 individuals taking medicine at once in a group setting with a different ratio of facilitators and therapists. Maybe you have 3 therapists, for example. And that would substantially reduce the cost while at the same time maintaining basic safety and effectiveness. And in fact, the process opens up different sorts of relationships between the participants, because they have peers with whom they can have compassion for, with whom they can have sort of a different type of experience that they can share their experience. And my understanding from the HIV/AIDS study is that many of these are older gay men who survived the plague years, found that the group was actually a hugely powerful aspect to the treatment, because they could be among people with whom they could identify, and they said, I'd no longer feel alone, that they were connected to other people who had a shared experience. And there's nothing as powerful for many people as a shared psychedelic experience where you're in the room together. So I think that it raises a lot of complex questions, but that's one way to bring the price down and to potentially actually improve clinical efficacy.
Yeah, awesome. Thanks so much. Any last piece of advice or anything you want to close with?
I just want to say thank you for inviting me on and doing this amazing podcast. It's exciting to see all of the interest that's come up even in the last few years. And my hope is that we can proceed with integrity.
Yeah.
And deep integrity to each other, both as researchers, as clinicians, as clients, as funders. Easier said than done, but and it requires quite a bit of soul searching and navigation. But I appreciate the opportunity, and I love that you are bringing these discourses into the world and sharing them with this podcast. So thanks for having me on.
Yeah, thanks, Dr. Belser. And really quick, do you have an online presence anywhere people can find you online? You have a website?
Yeah, absolutely. You can go to alexbelser.com, or my practice site is centerforbreakthroughs.com, and people can reach me there.
Awesome. Well, thanks so much for your time, and looking forward to chatting to you in the future.
Okay, thanks for having me. Take care now.
All right. Thanks for listening to the episode, Dr. Alex Belser. Hope you enjoyed it. If you have any questions, feel free to email us, psychedelicstoday, email@gmail. Love to hear from you. Any feedback, any thoughts, comments, anything like that. Again, if you haven't subscribed, make sure you subscribe to our show, Psychedelics Today, on Stitcher, iTunes, Spotify, wherever you listen to podcasts. And also, if you're interested in checking out our Navigating Psychedelics trip journal and integration workbooks, you can get those on Amazon. Really great way to prep for your trip and track your trip. There's some art pieces to it. And also the integration workbook, how to work through your experience. There's a lot of journal activities and different ways to work with the post session. So if you want to work with your experience or help prep for your session, go over to Amazon, type in Psychedelics Today, and those journals and workbooks should pop up. If you're having any difficulty integrating experience, or you're getting kind of like pre-session nerves, anxiety, or you have any questions in general about, maybe navigating the psychedelic field or anything like that, make sure you check out our services. You can go to psychedelicstoday.com. Under the service menu, we offer consulting calls and also some integration coaching. Integration coaching comes with either calls, or we pair it up with our online course. So you kind of get psycho education along with some supportive calls. So could be addressing any emotions you're feeling afterwards or pre-session, and really helping you understand your process and trying to make meaning out of it. So if you have any questions, feel free to reach out. Again, Psychedelics Today, email@gmail. And thanks so much for listening, and we'll catch you next week.